Mark and I were sitting there having some conversations. Blakely walked in after seeing some of his athletes here at Trinity and was like, "Hey, I got an idea for you." And that idea was, "Hey, can we have you talk? Because this is a request that we've had." So she's a licensed, my brain is not working today. You know how that goes.
I will do it.
I'll let you do it.
Thank you, Sean. All right, good morning, everybody. My name is Blakely. I go by Dr. Blakely with my student athletes and the people that I work with. I'm really excited to get to be here today. I've worked with so many athletic trainers over the years, and you guys are the cog in the machine that keeps everything working. So I'll explain a little bit about my background. What Sean was going to say is I'm a licensed psychologist. I have a PhD in counseling psychology. And that's unique. I'll talk a little bit about why it's important to know some of the backgrounds and the certifications, because sports psychology is becoming really popular. A lot of people are wanting to get into the field and be a provider in that space, but there's a lot of different professionals and opportunities to reach the people that want to work with them. So I think it's important to be educated about who you're going to be working with and the different kinds of things they can do. And then as I'm talking with you all today, I'll share a little bit about the places that I've worked. But partnering with mental health professionals and sports psychology professionals looks different depending on the organization where you work. So I want to speak to the role that you may find yourselves in terms of helping student athletes to initiate help-seeking behavior, making referrals, and even just like planting a seed maybe with exposing them to sports psychology in more of a group setting that might then increase the probability that they're going to reach out and talk to someone. And then I went off to school. I was a collegiate soccer player at Davidson College and had no aspirations of working in sport after that. I wanted to work in psychology, went to Texas Tech and pursued my PhD there. And I really came into the field at a time where athletic departments were just starting to consider hiring people full-time to work. So even when I was doing my PhD at Texas Tech, they didn't have a full-time staff person doing this job yet. So as a grad student, I was asked to come in and work with this population because, as you have likely seen time and time again, it's important for a provider to have some knowledge of sport culture to work with these athletes. Because sometimes when we send our athletes to work with a mental health provider, they don't understand some of the unique pressures, identity facets, the things that are going on with our athletes. So I had the opportunity to do that, fell in love with the work, and then I went to Penn State to finish my doctoral internship. It's a requirement of our degree. And then I did a postdoc at Lehigh to specialize in sports psychology. So I have the mental health background in my license as a psychologist, and then separate sport training. And I'll talk about why that's a little bit different later. And then I have a few of my stops there over the years. Currently, I'm in private practice just down the street. I enjoyed working full-time in athletic departments, but then kind of with life reasons and family changes, I realized I wanted to be in charge of my time, and that's given me opportunities now to get to collaborate with Trinity, Incarnate Word, Texas State, lots of local little kind of like different kinds of partnerships. But then I've also started working with high school athletes, and that's helped me to see a little bit about what's going on with that population and hopefully to be able to speak to some of the things that will be important for you guys. So, caring for our student athletes today, as Dr. Stevens was saying, obviously mental and physical health underlie the overall wellness of the athlete. And we are seeing a lot more reported concerns, especially in the mental health domain, in recent years. And luckily, what we're seeing is some of those levels of distress have decreased since pandemic levels, but they still remain pretty high. Does that fit with what you're seeing at your schools? Lots of head nods there, okay. So what we're looking at is acknowledging that both of these domains are really important in supporting an athlete's performance, understanding how the recovery is going to work, and just how they feel in terms of the kind of load that they're carrying. And what I think is really important, and what's kind of been maybe even contentious, I don't know if you've experienced this, but is how do licensed mental health professionals and athletic trainers work together to share information as it benefits the athlete instead of remaining siloed and not being able to talk to each other maybe as helpfully as we would want. So I'll speak a little bit to that, and the need for understanding how do we best serve our student athletes is really apparent. And the ways that we work together can be different. Like I mentioned before, in the collegiate setting, we have more and more universities, especially at the, I want to say Power 5, I guess it's Power 4 now, but level where you might have multiple providers full-time on staff. That's not the situation for most of us. At D2, D3 levels, even some small D1 schools, we still don't have full-time providers. Anybody in here working at an institution that has a full-time provider? A couple hands, so not many. That's helpful for me to know. So if we don't have a full-time person on staff, if you're in the collegiate setting, sometimes we partner with the Student Counseling Center on campus, but there can be challenges with that. And then if you're in the high school setting, typically what I've seen is you might have some guidance counselors that are available to your students, but to the general population, or there's referrals that might be identified that you can send someone to, but sometimes it's less clear about where those student athletes are going to land. So I'm going to talk a little bit about the different roles that we do professionally. I didn't even want to try to sum up everything that you all do because you wear so many hats, so I simply put the role of the athletic trainer is just about everything. That's true at any institution that I've been at, and you guys have a very, and I don't need to tell you this, but a unique role because of the amount of interaction you have with your student athletes. You're often some of the first people to understand when there's something different that's going on. Just in terms of their interaction, personality, just overall functioning. And you have a lot of time with your athlete on the treatment table, right? And so you usually get to know them in a way where there's a little bit more of a personal relationship. And in fact, my first office at Texas Tech was actually situated in the athletic training room, which I thought was helpful. They put me in the back room where the x-ray machine was, and periodically they would do drug testing, and there was a private bathroom in my x-ray room. And so they would walk in to come give a urine sample in the middle of a session. I'd be like, no, not today. Not the most private setting in those moments. But it was really helpful because just being around, I got to engage and see some of the sides of the student athletes that you do when they just have those moments where they have to be there doing their rehab. So those relationships are really important because connection makes such a difference when we're trying to talk to people about their wellness and about how they're doing. And if we have some of that rapport, we can then spend it in terms of how we're trying to help someone access care at another level. So this is where the distinction, I think, is important when we're talking about sports psychology. There's the mental health side of what sports psychologists can do, and then there's a performance side. Mental health professionals are uniquely educated, trained, and most importantly, guys, they're licensed. They're licensed to treat mental health issues. And that is different than many of the sport performance or even sport psychology providers that we're seeing because they have a different skill set. Sometimes, as in the case with what I do, those things overlap. But technically, what we see is people who do not have a psychology doctoral degree are not supposed to call themselves psychologists, but it happens often. And so it can be confusing understanding like who it is you're interacting with. So it's important to know, is this person who's calling themselves a sports psychologist actually equipped to treat mental health issues or not? And that can be fine, depending on what you're bringing them in for. But we'll talk about that in a little bit more detail. In the mental health umbrella, there's lots of different ways you can serve this population other than be a social worker. We have master's level licensed professionals. So it's not like only a psychologist can do this work. You can have a different license to work with mental health and still serve this group, especially if you then have some training, education, expertise, supervision in working in the athlete world specifically. So that's that last point is you may have expertise to treat depression, to work with anxiety, to look at these eating disorders we were just talking about, but they may not have unique knowledge of the sport world unless they've been trained in that as well. So we do the best we can, but it's important, I think, to know these nuances. And then I'll briefly touch on this. Sports psychology, like I mentioned, is getting to be really popular. Sometimes, I mean, on the outside looking in, it can look like a sexy job. It isn't always in reality. But what we're seeing now is more and more people are wanting to get to work with teams and work on elevating performance. And we do have a group of professionals typically at the master's level, who will do education and training in like kinesiology, biomechanics, physiology, sometimes a little bit of psychology, and they can do a lot of important work on stress management, on team cohesion, on communication, but they're teaching the topics more within those domains and from a point of wellness and higher functioning, and that's different sometimes from looking at an athlete who may have concurrent performance and mental health issues. The one thing that you can look for here when you have people coming in to see do they have specific training in this domain is the CMPC is a certification that's getting to be a lot more popular. A lot of schools will ask for that in a job ad for this kind of thing. What this is, it was designed to make sure that people who wanted to work in the field had specific educational background training supervision to kind of make sure that we're indicating that that expertise has been reached. So that's kind of the background stuff. What I wanted to get to a little bit, like a 30 to 45 minute session, and I think it's really important that we create a collaboration. So one of the first things that I do with a new team is I ask them to do a mental scouting report on themselves. They're very familiar with that language, and when we do that, it's really helpful because I ask them to tell me, what do you think your team already does very well, and where do we need to improve? And when we do that, they start to kind of give me a glimpse into the team functioning, the things that are hard, and what they might need some support around. And I'm curious for you guys, if you were to take a guess, knowing your student athletes, what do you think are some of the top topics that they ask for right from jump? Yes. How to deal with stress is a big one. What's that? Relationship, social acceptance. I get a lot of communication. How do we hold each other accountable? That's a hard one these days. A lot of times teams will ask me to help with confidence. Here at Trinity, perhaps not surprisingly, perfectionism is something I'm asked to talk about again and again and again. And so they give me a little bit of insight into what might be helpful, and then we'll lean into that. And I'll usually do a session that has some psychoeducation and some kind of experiential exercise where we're teaching something that can be used in the short term that hopefully gives them a success experience, so then they're more likely to want to engage with that going forward. So the kinds of topics that I might touch on in these sessions, you can see they're up on the board. But you can see that even though these are not put in clinical language, many of these things would be helpful when someone is feeling anxious, depressed, or struggling with the way that they talk to themselves. And so the idea here is hopefully this can be a preventative level of helping our student athletes with mental health when we still provide a performance-based service. What I wanted to talk about here too is it was really helpful when we're thinking about introducing sports psychology or like therapy for athletes to have some kind of opportunity where we're presenting this information as if there's not like a problem they need to fix. We're giving them tools, we're giving information, and when we can exchange things in that kind of way, the student athletes are much more likely to stick around and say, hey, I have another question, or I wanted to ask you about this. Because once they know who that provider is, it becomes less scary to think about talking to a mental health professional once they've had some kind of more neutral exchange. And that's been my experience here time and time again. I'm very grateful that we've gotten to provide as much as we have at Trinity, but we have a lot of individuals who will stay after a team session and say, hey, how do I talk about this more? So there is demand and there's interest, even though we're still really working to reduce that stigma that can exist around this topic. Questions about this piece? Okay. So this next one I wanted to throw up here because I think it's useful to hone in on like the things that we see our student athletes these days struggling with the most. And I was listening to Dr. Stevens' talk, of course, but I was also pulling up the most recent data the NCAA released to take a look at what are our student athletes reporting about mental health and their functioning. If you guys had to throw out a number for what percentage of athletes are still reporting that they struggle with overwhelming anxiety most days, what would you guess? Not quite 90. For extremely overwhelming most days, it was at least 30% of athletes, right? And what we're seeing is, like I mentioned, even though from pandemic levels we're seeing a bit of a decrease, that decrease is happening mostly for men, and they're still at high levels, and our women, our racial minority athletes, gender identity, LGBTQ student athletes are still struggling at pretty high levels. And the things that I tend to see most in my office tend to center around anxiety or performance anxiety. Like I mentioned before, a lot of perfectionism and high achievers, right? So we're really self-critical, we're really demanding of ourselves, and over time that can start to degrade them to the point where they're struggling with that depression, low mood, feeling irritable, not themselves, and lots of time loss of joy in their sport, right? So what we're looking at is how do we hopefully reach some of these student athletes before we're getting to the point where these things are at a crisis level or very problematic. And that's where I feel you guys come in, right? What we see here is a lot of times as these things are developing, they're quite common, they're pervasive, but that doesn't mean that it's a normal thing. And so what we want to be able to do is to keep our finger on the pulse and then have the communication skills and strategies essentially to be able to point out to the athlete what we see happening and then have an exchange about what do we do with this to help you access care in a way that doesn't feel like they're being singled out or that something's wrong. I do love this graphic here too. I wanted to mention it briefly. I'm sure many of you are familiar with this, but it's really helpful to talk to athletes about the relationship between stress and performance and pointing out that when we have zero stress, we're actually not performing at our best. Stress in and of itself is not a bad thing. Stress is necessary for performance. It's stress in the absence of recovery or stress at levels that are too high that starts to become problematic. And this is really useful to point out to athletes in these team sessions is I talk to them about this kind of, since we don't have a laser pointer, this area of the graph and helping them to identify typically where they feel like they are on that curve. And a lot of my athletes that I see in my practice tend to say, if this is a 10, I feel like I'm at an 8 or a 9 most of the time. Sometimes the night before a performance, sometimes when it's during, but we talk about we're not gonna have a switch to turn off your stress or your anxiety, but how do we start to build the tools through grounding, through diaphragmatic breathing, through self-talk, where you learn that you have a dial, where then you can turn that down to a 6, maybe in a 5, and then bam, we're back in that zone that we wanna be in. So that's kind of what we're thinking about with this language here. So I wanted to talk a little bit about, okay, you have a student athlete, you notice something is off. What do we do in terms of starting that conversation other than just saying, hey, I think you need to talk to a therapist? Signs to refer that you can pick up on earlier, like I mentioned, are noticing changes in mood, behavior, importantly, like Dr. Stevens talked about, sleeping too much, trouble getting out of bed, which is a lot of teenagers, but like in a different way than their normal baseline functioning, not sleeping enough, appetite. And then a lot of our athletes, especially for our young men and boys, is they will not relate to depression as much through the idea of being tearful or sad, but if we talk to them about feeling more irritable or having a short fuse or being numb, that's the way that they're more likely to language some of these symptoms of depression. So those can be other ways to think about trying to reach the student athlete you're talking to. The technique that I really like for opening conversations like this about hard topics is normalization. Normalization is essentially communicating that this thing that you're going through, you're not alone, right? This happens to many of us. As a psychologist, in every first session when I meet with someone, I need to assess for suicide. It's not a light topic, right? People are not used to talking about that. So usually at some point in my intake process, when I'm talking with someone, I'll reference that they talked about being stressed earlier. And the way that I will ask that question is I'll say, you know, when people are feeling really stressed or overwhelmed, like you've been talking about, it's not uncommon for people to think about death, dying, or suicide. Has that ever happened for you, right? And so you'll see there, I'm saying it's not uncommon when this kind of thing is happening. And that's a way that I want you all to think about, how do we normalize this thing that we're pointing out? When stress levels are high, when you're in the thick of season, when there's a lot being placed on your plate, it's not uncommon to struggle with sleep, or it's not uncommon to feel like you have a lot of weight on your shoulders. Is that something that's going on for you? So normalization is a great tool. The other thing that I think is really useful, and I teach this to student athletes as well when they're checking on a peer that they're concerned about, is not so much saying like, hey, you're being rude in the group text, or hey, you're not doing what you're supposed to do, or it's disrespectful, you're showing up late. We really avoid interpreting behavior or making an assumption. Instead, I teach them it's really important just to stick to what you can observe and to point that piece out. So I gave a couple examples here. We talked about energy deficiency in the last presentation. Instead of, I think you have a problem with food, it would be helpful to just point out, I notice after team lifts, you've been skipping the protein shake and you've missed a couple team meals. These are observable facts that leave it for the athlete to hopefully feel less defensive, because we're sticking to things that we're not adding any extra layer of interpretation on top of that. You see the other behavioral examples there, but sticking to the observations can open the door to say, this is what I'm noticing. And then part two is, I wonder if anything's been going on for you lately. Do you want to talk about anything? Could something in your life work better for you than how it's working right now? So that can be a nice opener to kind of not have to use the language of depression or anxiety, but just simply what we're seeing and allowing them to fill in the gaps for us about what might be going on behind the scenes. This is the other slide in terms of the conversation that I think this part can be tricky depending on your institution and where you're at. But the first point I have up here is, if you're thinking someone needs a mental health referral, it would be really helpful if you knew a potential place they could land or what their next step was going to be. And this is something that truthfully I've had to figure out each institution I've been at since I started partnering with people on a contract basis. And even here at Trinity, for example, I had to find out, do team docs prescribe psychiatric medications? Is there like a referral process to get someone seen at the student counseling center? Is student insurance something that needs to be factored in as we're helping them find a place to land? So there's a lot of legwork potentially that you need to do, and most schools need to have an action plan. Mental health, NCAA mental health best practices says that schools need to have an action plan for how we respond to a crisis, but also how we help someone initiate services. Your high school may not necessarily have this, but there should be an organization or someone who oversees the area that can point in the direction of the resources. So if you don't know these off the top of your head, it's helpful to tell the student athlete, hey, we can figure this out together. I'm gonna look this up, or I'm gonna ask this person, we'll get back to it together. The other thing that I've seen that can work really well is sometimes compliance of making that first appointment or reaching out for a medication referral. There can be just procrastination. I don't feel confident doing that. A lot of our young people don't like calling people on the phone for whatever reason. And so sometimes if you can do that sitting together in your office, it increases the likelihood that they're gonna comply with that referral. The other thing that I think is really nice is, again, thinking about, we've come a long way generationally with people being open to talking about mental health, but anything that we can do to reduce stigma is beneficial. And so if we can speak to the potential benefit of therapy or talking with a psychology provider, I think it can really help build their confidence or instill some optimism or hope that things can get better. And that's what people often need help seeing when they're in a place of being stuck. So if there's anything that you can point to, like an athlete they might like who's talked openly about working with a psychologist, or pointing out that they don't have to have a problem in order to go to therapy, if something can work better, it's a good enough reason to go. That kind of language can really usually, hopefully, help people feel more open to pursuing the services that they might need. The last thing that I think can be really helpful are what we used to call warm handoffs at Arkansas. So I had an office that was close to our nutritionist, and I actually do specialize in working with disordered eating and body image. And so we would often walk the student athlete and say, hey, I wanted to introduce you to this person. We were talking about how it might be beneficial for you guys to set up a meeting. I wanted to make sure you two connected. And that was another behavior that was so helpful. So whether that's making sure you have a warm handoff with a team physician or someone else on that treatment team, that can go a long way. And if you don't have physical access to that person, the other thing I recommend is, with the athlete's consent, saying, hey, can I put you on a group text with this other person to make sure that I connect the two of you? So then I know that it's happened, and it's been helpful to make sure that those things happen with a bit more efficiency. Any thoughts or questions about this piece or this conversation? Or any examples of how that's gone? Yes, wonderful question. So with minors, I do think there has to be some kind of education around, for therapy, they cannot consent to their own care, right? And so it will be helpful to say, hey, and I do this still with collegiate athletes who might need help paying for therapy, right? It would be helpful for your mom and dad or your parents, your caregivers, whomever, to have some kind of idea that something's going on with you. That doesn't mean that they need all the details of what we've discussed today. What would you feel comfortable telling them so that we can get them on board with helping you here? So even a recent student athlete comes to mind who wanted to initiate services, and they did not want to tell parents. And so we had to use a couple sessions, honestly, until they got to that point. But we talked about this person was struggling with an eating disorder and did not want to disclose that piece. And so the language that we eventually got to was, I've been having a harder time, and my school told me about a sports psychologist. I really want to meet with them. Can you help me do that? And so sometimes giving them those ideas is important too. And then hopefully, if you are making that handoff, you know the provider, and you can even give a heads up of, this parent is very demanding and will want to know everything that's going on. And we do know how to deal with that, and a lot of times, like in my paperwork for minors, I'll explain to parents, like, yes, you're consenting to your child's care, but here are the things that I would share with you, which are essentially, your child is telling me that they're going to kill themselves today. That's kind of the level we're talking about. Or they're doing something that's very risky to their health that we need to intervene. Everything else is going to stay between me and your child, right? And so that kind of education up front, I think, is really important. Does that answer that question? What's? Yes. And what's the fear there? That the athlete will just say no? I think that you try to roll with the resistance. You're right. You don't have to do anything for your kid. And this felt important enough to bring to you. And if the kid consents to it, I'm noticing their sleep is off. They're not themselves, and things could be working a lot better for them than they are right now. And I hope you would consider this for your child's care. There's not, but hopefully then we would figure out, how else can we support this kid? Is there a guidance counselor they can go to that's available through school? I think it's hard. I think then you talk with the athlete about, okay, so if they can't see a mental health professional, what social support do you have? Who is a person you feel safe talking to about this? You're thinking about, how do we surround them so they're not isolated and struggling with this alone? And then you are not the mental health provider, right? You don't want to fill that role. It's not your job. And I think you can say that is I'm happy to be this sounding board and to hear what's going on with you and support you. And hopefully we can keep thinking of ways to help you access the service that you need and having that conversation with your parents. Because sometimes it doesn't happen the first time, like you're saying. Ideally, everybody would jump on board. That doesn't always happen. Yes. Yes. I'm thinking of certain populations. I've seen this with a lot. For some kind of different cultural backgrounds, the idea of talking to a therapist about what happens within the family is very frowned upon. And so I think providing some education around, again, the less, I'm trying to think how I would word this. I think we can acknowledge like it is thought of to go see a therapist, there has to be something really wrong with you in order to pursue something like that. We're finding that that's not the case, that this is something that can be preventative and helpful, and it doesn't mean that there's necessarily anything really wrong with your child, right? This is something that we're providing them as a resource instead of like patching something that's already falling apart. And sometimes I think they're more willing to get on board with that. I think you can also kind of steer them in the direction of things that would feel more palatable to hear in terms of we're going to help them with their self-esteem. We're going to talk to them about communication. It doesn't have to be we're assessing them for depression, right? So trying to find that language I think can be useful. And sometimes, honestly, because I've seen these kids as college students and parents would not consent to them receiving treatment before, or I have some minors now that I'm like, oh my God, this kid needs to get away so they can be in a healthier environment. I think we do the best we can to kind of patch them up and tell them things can be different. At some point, you're going to be able to pursue this for yourself. And again, instilling any kind of optimism or hope. These are good, hard questions. Anything else here, guys? Yes. Yes, I think I think that could be a helpful way to approach that as well. Yes, sir. Yes. Yes. I think that's really difficult. And a lot of times our hands are tied. There's not a lot. We have to work within the bounds of what we have permission to do. I've seen that, for example, with a client whose parents really were probably the primary contributing factor to that child's eating disorder and depression. We're not going to be able to remove them from the home. It's not reportable to CPS, but it's also not the healthiest thing for the child. And so I think that's where when I work with those clients, they'll even say, we'll have conversations around, can I pull alongside you? Is there anything that I could communicate to your parents that you're not having to do this one-on-one or we can do together that would feel helpful? And if it's a really difficult situation, the response from the client is often no. I don't think it would help. And that's where I think I really defer to the expertise of that person on their own experience and say, okay, Know that it's there. I'm willing to help you in those conversations, but if that doesn't feel safe, we're going to do everything we can to help you function the best we can within this environment. And it's important for me then, I think, to acknowledge and validate this isn't kind, this is unhealthy, like that was inappropriate, because we're helping them distinguish that family of origin environment from what they expect the rest of the world to be like. And I think in those little ways we do make an impactful difference, even if we wish we could do more. Yes, sir. Yes. Yes. I think on an individual level, but we're talking a lot about these individual conversations. Our job is to present information about options. It's to help people make informed choices about what they're going to do for their care. If there is the obstacle of parents won't consent or the finances are there, whatever it may be, we may not be able to plug them in that way. But I think that's then where we say, I'm going to stay within the bounds of my competence in my professional role here, and I will be a supportive, caring presence for this child, knowing that having an accountable adult really does decrease the risk of suicide and a lot of these other behaviors that we can be afraid of, and knowing that you are making a difference. And then on a more systemic level, if we can't get that student into therapy, I'd be thinking about what are we doing program level, like in terms of bringing in some wellness talks, teaching about stress management, teaching about coping resources that might still benefit that kid that we don't have to get permission to teach them. And if we're doing that, then I think it's also we work with ourselves about being compassionate, about I'm doing what I can, I do care, and I'm doing my job, and I'm doing the best I can by this kid. Yes, sir. I do think that if we're starting to see like suicidal ideation, we do need to respond to that. That is a crisis that's happening in front of us, right? We're seeing more and more of our students reporting that they're not just like contemplating suicide, that they've actively considered it on college campuses. So this is not something that only happens once in a blue moon. When it does, it's really important to tell the student, tell me more. Tell me more about what you've been thinking, what's going on. If you're suspecting that this is something they're considering, you will not plant the idea in their head. Talking to them about suicide directly and using that word is really important. And so in that moment, we're responding to, is there a crisis that's happening right now? And then that's where we do usually have an emergency action plan or somewhere that we're gonna get that student connected and make sure that they're stabilized. Other resources that I really like that they can use is the crisis text line, 741-741. That's something that they can reach out and use. We have suicide prevention hotlines as well. Those are things that we can provide to them that they can engage with. And then if the home is dysfunctional to the point where there's neglect or abuse occurring, we can report that. That's a hard call, right? That can also erode the rapport, the trust, but sometimes that has to be done, and it's important to do so. You guys have the hard-hitting stuff. Yes, in the back. Yes. Beautiful. Correct. And that's important. That's important, right? Saying, I would love to be able to do these things, and I'm not equipped to do it. We need someone else on our team to help you with this. And I love that you said, let's make that call. Is that okay with you? And then, you know what, I may not be able to go to the appointment with you, but I will follow up and ask you how it went afterwards, or something like that, right? To say, like, I'm still here with you through the process, even if I'm not the person. Great, great. I know we've gone a while on questions here. My last slide is basically the benefits of offering sports psych, which I think we've kind of touched on, and then any Q&A, which we're already into. So any other questions from you all about any kind of mental health concern, the disordered eating things we were talking about earlier? One pro tip I would love to give you for that, for disordered eating. The question that I use most often to assess if this is something that we need to talk about is simple. It's this: do you think about food or your body more than you would like to? It covers a whole host of things, guys, and this is easier, I think, too, to get men talking about it. We still think of disordered eating as a women's issue. It is not. Having worked with several college football staffs, disordered eating behavior is rampant in those groups, right? We see it at all different kinds of settings and levels. But we want to be able to get them to talk about that. And a lot of times in these conversations here, I'm talking with student athletes who said, I've been struggling with binge eating or restricting, or I hate my body, and it's been 4 or 5 years and I've never talked about it before. So this is a lot more common than you would probably expect. So asking that question is really helpful, especially maybe when you're asking about the female athlete triad. Most of my disordered eating or eating disorder clients have not actually lost a period. It doesn't mean that it's not clinically significant and that we should be treating it. Other questions? Yes. For what kind of information? So I do think the NCAA is not without its flaws, but they do put out a lot of good research in this area, and there's informational, like, fact sheets around depression, anxiety, disordered eating, and substance use that I think are very beneficial. So if you just type in NCAA mental health, you can find reports, you can find the best practices, and there's a lot of psychoeducational information in there. In terms of other resources, let me think about that. I'll follow up with Sean, and maybe we can disseminate that if I can kind of have a moment more to think through that. The other thing that I put on there at the very end here is my contact information as well. And so I do have an Instagram that's just my professional Instagram that has some of the psychoed topics that we talk about with stress management, diaphragmatic breathing, anxiety. So there's some free content there. I'm also happy to engage with you or answer questions. I love getting to do kind of these meetings with staff because we can create quite a ripple when we equip people who have their touch on a whole lot of our athletes. So I would love to be able to continue to engage with you if you have questions. Anything else? Yes. Great. I think that's fantastic, having things in the bathroom stalls. And we want to share this information before people need it, right? So a lot of times when I'm working with student athletes and we're working together and there's been some kind of suicidal ideation, even if it's not, I have active plans going on, we'll still create a plan and talk about all the resources. So if you should ever need it, you don't have to go track this information down. So that's, I think, a wonderful point. All right. Thank you, ladies and gentlemen. I really appreciate your time.
Again, we really appreciate everybody. I hope that you all enjoyed this year's symposium.